Yeah,
Anyway,
we are live now.
Okay. Good evening, everyone, and welcome to Gyan Pravah podcast series, episode number 219, where I, myself, Dr. Sita Ramamurthy Pal, chairperson of the Genetics and Fetal Medicine Committee, bring to you where we explore the frontiers of fetal medicine and genetics. And on the 4th of every month, I get some luminaries from the various aspects of fetal medicine. And one such luminary today, the legend himself, is Dr. Ashok Khurana. Thank you and welcome, sir, to this podcast. This podcast, Gyan Pravah series, is the brainchild of our visionary president, Dr. Sunita Tandulwadkar, who's the president Fogsi this year. And every month when I introduce her, there is another project that has been added to her multitude of projects that has been ongoing. And every project has made a difference in the lives of our Foxians, of our women, of our country. And it is exploring the different aspects of women's life that we can, empower them, like Sampurna, like Doti Ke Zindagi Ke. And especially this podcast has been a very inclusive nature of, including everyone, those who are the chairpersons, and, exploring their potential to interview different people and explore themselves. So thank you, madam, for this opportunity. And I must say that, with her different projects of being inclusive, she includes all of them who are in the office, outside the office, and has kept everyone busy, but has made so much of difference in all the projects that is ongoing and will be going on until, next year. So thank you, madam, once again. And I invite you to give your words of wisdom
thank
and
you, Sita.
welcome this podcast.
Thank you, Sita. Thank you for your kind words. And Arogya Yoga Yatra is one of the
Yes,
beautiful
of course.
project. I know it's difficult to remember so many we do. And thank you, Sita, for another thing, not only because you are my most dependable chairperson, very hardworking, very sincere. And why Arogya Yoga Yatra has come, because in Arogya Yoga Yatra, Ashok, we do the camps in the medical colleges. We go and we do our number of know your number project in those medical colleges, and those wherever Sita had come for those Arogya Yoga Yatras, she has taken an initiative. She visited every medical college. I still can't forget Puri, where I got exhausted with the heat. And I said, Sita, I'm taking a break, but remaining 6 medical colleges with the team she completed, I will never forget those incidences.
It was
So
an experience by itself, but thank you.
but that is the dependability of Sita. She's so down to earth. And next year, probably we will pull her leg saying, you are a first lady of Foxy. But I know she doesn't put that feather in her cap. She works herself. She works very hard for it. And Sita, one day we would love to see you on this highest position. You have that capacity. You need to have that dream and gist to do that. Ashok, thank you so much for coming on a Foxy platform. Every day, 8 p.m., I join to welcome that faculty. They should not feel they are left out only with the chairperson. Foxy president is always grateful, feel honored to welcome you, and will always be there to show the respect from the organization towards the faculty. Ashok, you are one of my favorite faculty. You know that my no conferences goes if it is having the OB/GYN or a fetal medicine, you have to be a part. And I don't know how many times you have flew down to Pune. You never say no. You are very kind and you are so busy now with your multiple organizational work, but your zest to teach the fetal medicine never dies off. And that's why you are evergreen star of fetal medicine in India and abroad. So
Thank you.
thank you for being here with us. And our protocol is Sita continues the dialogue with you. And I watch the podcast from the viewers link.
Excellent. Thank you so much for this. It's always a pleasure being in all of your meetings and your projects, and I truly look forward to them each time.
Thank you. Thank you.
Thank
Thank you, madam. And thank you for joining, for making it a point to join every podcast and encourage us chairpersons, wherever it is, it be it her, the chamber, be it the airport, be it the flight, even, and even if it's a conference where she has to come out of the inauguration and join, I truly hats off to your commitment, and we all draw inspiration from your
Thank,
commitment and
thank
work.
you.
Thank you
Thank
so much for joining. Thank you.
Bye-bye. Enjoy your dialogue.
Thank you.
Thank you.
So today we are going to talk about artificial intelligence in fetal medicine, the way forward. It's a fascinating and rapidly evolving area. And today we are going to discuss the current applications, challenges, ethical considerations, and with the person who's been at the forefront of applying AI in healthcare. And today we have none other than the legend himself, Dr. Ashok Khurana. Thank you once again, sir, for joining us. And it is my honor and privilege to introduce. I know sir doesn't need any introduction, but even if whatever we say will be less for him, but the most important word is he's been an inspiration for all of us, even the seniors and the juniors who've been learning fetal medicine. And as madam said, the zeal and the energy that he has, always, we sort of tend to get tired, but sir never tends to get tired about teaching, which is his passion. So thank you, sir, for doing all that you have done in the area of fetal medicine and with the Society of Fetal Medicine, for which he's the mentor emeritus. So to officially introduce sir, he's done his MD in radio diagnosis and MBBS from the prestigious All India Institute of Medical Sciences, and also has trained at the Harlev Hospital in Denmark in ultrasound. He's the chairman and consultant in reproductive ultrasound at the Ultrasound Lab, New Delhi. He's the past president of the Society of Fetal Medicine, but the mentor emeritus right now for Society of Fetal Medicine. Former ISUOG, International Society of Ultrasound and Obs and Gynae ambassador in India. Former dean of the Indian College of Medical Ultrasound. He's the director of the Scholar, very successful Scholar MD Fetal Medicine program, where so many of the students have learned and are excelling themselves in the field of fetal medicine. Program director of the Apex Institute of Fetal and Reproductive Sciences, editor-in-chief one of the most prestigious journal of fetal medicine, and he's the president-elect 2526 of the Indian Federation of Ultrasound and Medicine and Biology. But most importantly, sir has been so inclusive, and sir has been so encouraging to all the new members and the youngsters who are doing fetal medicine. That itself is a big source of inspiration, sir. I salute your energy, your drive, and your enthusiasm, and I pray that you continue to guide us all throughout, so that we have a teacher like you to teach us and guide us always. Thank you.
Thank you. That is such a kind introduction, and it says so much of what I believe in. And thank you so much for having me on this show. It's something I've been waiting for a few months, and I'm really sort of so excited to be here because I want to introduce this new concept to as many people as possible. And I think this is a fantastic forum.
Yes,
Thank you
sir, because
indeed.
we have the audience is not only obstetricians and gynecologists. There are many non-medical people as well,
Yes.
and so we want to obviously impart the knowledge and the experience and the wisdom from people like you as to what we are in now in the area of fetal medicine. So, sir, to begin with, I know you've come a long way from the time you've started ultrasound in AIMS, and you've seen it all evolve. So, how do you think fetal medicine has evolved over the years, and what has sort of driven you to this sort of point of being there here from where you are and now where you are? To
Thank
start
you.
off on a personal level.
This is so kind. Well, fetal medicine was a very new concept. And when I first came into my MBBS, fetal medicine was not there. And by
Yeah.
the time I finished MBBS, there was sheep and sheep and sheep and sheep. And we didn't know what to do with those sheep. But there was something there that was exciting. And then I was wondering, should I go into pure sciences or should I go into one of the clinical sciences? And I thought I'd lead a very easy life. And I said, let me take up radiology and be a distant person from the patient. But that was not to be because ultrasound came along. And just when I was beginning my radiology career, we got our first static scanner. It was the first ultrasound scanner in India. and it came to the All India Institute of Medical Sciences through a United Nations grant. Sure enough, it worked for 2 days and broke down on day three because it was an old machine and we had no idea
Yeah,
that
how
it
it
was so
works.
delicate. Yes, and the electricity went boom, and that was it. Well, we were lucky. In 2 months, the next machine came along, and that was the first real-time grayscale ultrasound scanner that we had. And that's where the story began. And I said, look, I have to pull myself away because the fetus needs to be respected because you have great mothers and a lot of things are being done for mothers. But what are we doing for this fetus who actually is so much in the clutches of the mother for 9 months and yet needs to be treated with its own independent dignity? And if you don't give a healthy baby to the mother at the end of pregnancy, you're failing as much as not having a healthy mother at the end of pregnancy. And
Absolutely.
therefore, the concept of maternal medicine and fetal medicine came along. And there was already in the West this business of interest in the most common cause of mental retardation, which was Down syndrome, and the most common cause of disabilities, which was neural tube defects. And prevention was beginning to come in at that time as a concept, and prenatal diagnosis began. And then we built on it. And luckily for us, we were able to build on the wisdom of the West. And we didn't grab it all because it was expensive, but we started very slowly and we brought in alpha fetoprotein and realized that our neural tube defects were really, really tough to handle. And we did a lot of work with them at that time, including prevention and social programs. While we were doing that, we realized that yes, something needs to be done more radically. And that's when we jumped right into it with genetics coming along, with the laboratories coming along, and all of us put there. And we realized that we need a multidisciplinary system here. And we created one finally in 2011 with the Society of Fetal Medicine. So that in brief has been the story of fetal medicine in India. And today, of course, we are ahead of world class, and the world acknowledges
Yeah.
that ultrasound scans are the most fantastic in the world, that genetics is way advanced of most places in the world with more access to so many people in a nation that is so big, and the fact that our clinicians are very well informed now of how to handle a mother and fetus as two different entities. So that's where we
Fantastic.
are. Mm.
I mean, from where the Society of Fetal Medicine, I think you have almost single-handedly got, where it was and where it is now with its, everybody, waits to become a member and waits to listen to all the programs or attend the programs of Society of Fetal Medicine. I think, Jan, you have played a major part in that, so and thank you for that. Uh,
Thank
you know,
you.
what in your mind, in your opinion, how has fetal medicine evolved over these years, from the time you started ultrasound? What do you think, where are we now, and how would you think AI has sort of come in, in this aspect? Where does it currently
Yeah.
stand?
So, it started actually just before ultrasound, and we realized that we needed to do something about sex-linked diseases. And even before ultrasound came along, Professor I.C. Verma, who's truly the father of fetal medicine in our country, said, Ashok, you have to send me samples when you have your gynae posting, and I will look for bar bodies, and we will find out whether this patient might be a carrier because they've lost all their babies. What do we do for them? And that's where it started. And then when ultrasound came along, we actually started more with amniocentesis than diagnostic ultrasound. So it started as intervention. And then we went on to, with the help of Dr. Ratna Puri, Dr. Deepika Decker, Dr. Madhulika Kabra, we were pioneering it at that time without realizing we were pioneering something so big. And that's where we started. And then we realized we grew. As we grew, fetal medicine grew. And then we realized that there were these things coming along where there was so much information that no individual, a radiologist or a geneticist or a practicing obstetrician or even a researcher, was ever going to be able to handle. And the only way out was A, let's get things organized in terms of good information from genetics and ultrasound. And B, we must have ready access to that in a way where we can handle a lot of information at the same time. So artificial intelligence started to come in to make sure that we are doing the images correctly, and it came in to guide us on what to do with the information. And that's where we stand today. Because
Okay.
we realized that natural intelligence was too slow a function, and there was just this information boom that would be of use to the patient. What also drove me was the fact that there is this concept of India that we will either go in the fifth month or a delivery to a doctor, and we want everything at the point of first care, or either the mother will die or the fetus will die, or we will have a malformed fetus. That's not acceptable. So, what AI has made sure that we're doing today is that at the point of first care, when somebody comes for an ultrasound scan, they will get great ultrasound findings. They will get, even with people who are not so skilled, an excellent diagnosis because AI facilitates that now. And after that, we put all the information together and do the best genetic tests. We send it for the appropriate genetic test because AI guides us on which syndrome and what test. And the patient can then go home and wait for the results. So nobody will really need to say, I will abort my fetus on flimsy reasons, or the fact that never mind, I just have to bear my destiny. So both extremes get avoided thanks to artificial intelligence.
Oh, that's fantastic. So would you say that it would sort of help in detecting sort of subtle anomalies which could be missed by, even some of the, would you say AI would be helpful in doing that, or it is just going to complement what we already have?
No, it's both.
It's both.
So the simple things, like some of the machines today have what we call a scan coach. While I'm scanning, it will identify that I got the correct plane, and it will store that information, and it will take a measurement when necessary. In addition to that, if I'm not doing it correctly, it says, look, get these landmarks.
Hmm.
And that screen plays continuously on my monitor at the same time. And I can then, with my minimum skill, still achieve that wherever in the periphery I am. And then it says, okay, you've got this right. Then we have not yet reached the stage where we can have, say, and straight away that this is the abnormality. For that, we still require natural intelligence. But once I've identified that, I use AI to put together what are the possible diagnoses and what should be the test. And again, AI plays a role there. The third most important role that it plays is that it can see things that the human eye cannot see.
Okay, yeah, that's it.
And there are two big areas where this has happened. And the first one of these is in looking for fetal lung maturity. We sort of presume that everybody at 36 weeks has a mature lung, a fetus has a mature lung, and that is not true. And so at the Fetal Medicine Barcelona, they did a huge amount of information on this and said, okay, we will feed in immature and mature lungs in routine four-chamber views, which included lungs, into a machine, and put in lakhs and lakhs of information, and then said, okay, this lung was mature, this was not when it was delivered. And that gave us the first test where we went beyond texture that the human eye can see and recognized that this is mature lung versus non-mature lung, because the machine could pick up something that the human eye could not see. So we no longer at term had to do an amniocentesis with our shake test and foam test and everything else. And we said, okay, this is mature lung. The same thing then a few years later has been applied to the cervical assessment, the assessment of the cervix for the prediction of preterm delivery. So in my standard view, which is a transvaginal view at 22 weeks of gestation, which I'm doing during my anomaly scan,
Mm.
I'm of course doing cervical length, and we know it's not the best predictor. And we know that elastography also has limitations. But we fed in who delivered preterm and who did not. And the machine learned to recognize something that you and me cannot see, and now tells us this patient has this chance of prematurity. These two still run as commercial programs with dedicated software, but anyone can subscribe to these. And so
That's
these are the
fantastic
ways
because
in which they can see things that you and me just cannot see.
yeah, that's the advantage because I mean, you said this an example because I was wondering where could it help where the human eye cannot see, because it's important because sometimes we deliver babies around 37, 38 weeks, assuming that the lungs will be mature and they still have problems with the lung maturity. So I
Yes,
think this sort of information which AI will guide us will be a major breakthrough. And of course, preterm labor being the capital in it. So I think
yes,
that comes into that will be a big help for us.
yes.
So, so is this available? Sort of, can we use it as of now?
Yes, So,
maturity.
we used it before COVID and we really brought the price down because our numbers were fantastic. And so, although it was hugely available, the cost was high and we brought the cost down to a very affordable 3,500 rupees per evaluation. And after that, the company got bought over twice and we lost our contact. Now we're negotiating with the new company that's handling this so that it's a very simple licensing program. You just buy the license and you put it up on your internet on the right site and you get your answer. So it's really been translated commercially beautifully.
Can there be an issue of it over diagnosing or over, because everything is machine based and software
Yes.
based. There
Yes.
is always a possibility of, sort of,
Yes.
especially in cervical and screening, if it says that, yes, there will be a problem. So is there a likelihood of that happening? Do you
It's
think so?
been validated very much, and the false positive rate is much, much less than cervical length, and the false positive rate is much, much less than elastography in terms
Oh,
of the cervix. In terms of looking at the lung maturity, again, the false negatives are down to zero, really.
oh,
And the fact that the lung may be immature is also very, very, very down to zero. So the validation has really proven that things have gone very, very well with this stuff.
oh, wow, that's
Yes.
amazing.
Yeah.
So, and in terms of AI in imaging, do you think beyond imaging, where else can it be used in terms of like, predictive analysis or genomics? How does that help? Because we are working as a multidisciplinary team where the
Yes.
ultrasound is there, the genetics is there. And so as AI helped in those aspects as well to make it easier for the clinician to counsel the couples.
Tremendously. And so we have very simple forms of AI that do this, which is that I find a site, for instance, and I can mention this site because it's a free site. It's called Phenotype Beta. And you become a member free of cost. And it can even teach you and say, okay, you can go syndrome by syndrome. But if I find, for instance, a hypotelorism and a proboscis, and I find a holoprosen carefully, it will immediately tell me that, look, this is either a trisomy 13 or that this is a deletion 13 and sorry, duplication 13. And similarly, you can have 9 signs and you're not able to put them together, but the machine has been taught to put all these signs together. And we have thousands and thousands of syndromes that can be recognized because of this. And then I will know, should I do an exome? Should I do just an MLPA? Should I do a set of genes? And so on.
So life has really been made easy
That's
for us.
right. And this is not the only engine. There are several other engines, but I like to use this one because it works really well.
So
And
apart from cervical length screening, so do you think it can improve our accuracy in predicting other adverse outcomes as well, which we are so worried about, especially in terms of,
yes,
preeclampsia, because we're all, we are talking about other syndromes, which are rare, but
yes,
the problem facing us is the more commoner ones. Do we?
true. So, in terms of each one of these conditions, which is growth restriction, estimation of fetal weight, in preterm birth, in the prediction of shoulder dystocia, you put in your clinical findings, you put in the patient demographics, the clinical characteristics of the patient, and you get a scoring system. And for all of these, for the past 6, 7 years, AI has given us answers, including hypertensive disorders and including fetal heart rate monitoring. So the computerized CTG was really the first one, but the
Hmm.
computerized CTG then giving us alarms that yes, this is truly the short-term variation, and there's too many of these short-term variations. Please hurry up and take a decision. So that is really something which is fantastic because it is facilitated decision making for people who don't have the skills or the experiences yet.
Yeah,
And in a country like ours, that really is the difference between fetal life and fetal death and intact survival.
absolutely.
Sitting in a village now, we know that, okay, I have to intervene and I must do a cesarean section urgently. Or the fact that if I don't have cesarean, then I counsel my patient and says, I'm so sorry, but I'm afraid there's going to be terrible trouble with this baby.
Yeah, I think that will change the way we practice medicine in general, especially fetal
Absolutely
medicine.
true. Yes.
So do you think there are any ethical concerns here, especially when we're dealing with life and issues? Will there be a problem when we're using AI to, of course, we do it as a for the betterment of the woman and for
Yeah.
the unborn child, fetus. But do you think that could be a concern anywhere?
Well, you know that whatever you put on the internet can always be hacked into. And so, truly speaking, there is no privacy. But artificial intelligence has got built into it patient privacy that is of the scale of never ever before. And that is why a lot of vendors have now incorporated this into their machine, and they encourage us to also buy this kind of software so that we can use it. So, in terms of patient privacy, that's all been overcome pretty much. The other
Right.
thing is that suppose something goes wrong, who is responsible? Is it the software company? Is it the doctor? Or is it the hospital? And who will take the responsibility? And all of that is defined in each contract. So we know that all the legal concerns have also pretty much been looked after because that is at a global level.
Right.
Yes.
So, sir, how does it change the way we counsel patients now? In the sense, now that we have AI here, that
Yes.
has it changed? I'm sure it has changed your practice. So, can you just enlighten us,
Completely.
sir,
Yes.
how it has changed in counseling them? And do you think the parents are more receptive to this nowadays? Even yes, the so-called affording ones would be, but the other ones as well. What is the response of the patients to these?
It's every patient is very aware of smartphones because everyone has a smartphone. And they used to Google before they come in, and now they're all doing Chat GPT.
Yes.
Yes, now we have been able to actually change things in two ways. One is diagnosis followed by stratification of healthcare, and AI helps in that. That look, the patient comes to me, can this be handled here? Can this not be handled here? For instance, we now have software which we've developed along with the data produced at the district hospital in Gurgaon, along with the government organization called the Translational Health Institute of India, THSTI, where we give them thousands and thousands and thousands of normative data on ultrasound scans in pregnancy. And these patients were followed up from the beginning to the end. And what we did in this was blind sweeps done by anybody. In India, it was the radiologist over the maternal abdomen. And this data was then sent off to Oxford, and we worked with them. And so there are two things that we can already identify at term, and that is there a placenta previa, and that has a 90 to 95% detection rate, and is it a breech presentation, and that has a 95% detection rate. So tomorrow, even if I don't see the scan and I just do those sweeps, my
Sweeps.
my A&M or my Anganwadi worker can do these sweeps, load them onto the internet, and I know that that patient should not be delivered in the village. This patient should then be referred to a tertiary center. So she gets into our wonderful vans that we have available everywhere. And she actually gets an official referral to go to that hospital. So baby is safe and mother is safe.
That's
And
amazing.
all of this has got its roots in a district hospital in Gurgaon, which has got a mixed urban population of people who can't afford very much. So
Wow.
that is going to be the revolution that we will in the future also be able to identify, and we're doing it already, dating of pregnancy. So many of our patients come late, and then instead of going by biometry, we now look at morphology and say, okay, this fetus is 12 weeks, 4 days, or this fetus is 20 weeks and 5 days. Because we know that that's how morphology changes, which you and me cannot see. But by looking at the brain, by looking at the abdomen, by looking at the texture
Anatomy.
of the liver,
Correct.
etc., the
Okay.
computer is able to tell me that this is for dating, and it works very well.
That's fantastic. So the ENM has just to do the sweeps and it will automatically give us all this information.
Absolutely. And there's no question of sex determination because these are blind sweeps.
Amazing, amazing.
So it's
So,
fantastic.
but
Yes.
that doesn't increase the cost of, are we able to incorporate this into the routine by without increasing the cost? Do you think that
There
is
is there is the ultrasound scanner which is available,
that
and all
is
we have to do is to find a scheme that we have medium or high-end machines, and a good medium-end machine can look after the sweeps.
wow,
And yeah, and for the breech and the placenta previa, you can even use a low-end machine.
fantastic. I mean,
Yes.
and
And
that's working very well already, you said in Gurgaon, isn't it?
that is right. Yes. Yeah.
Great, sir. So in terms of, you said there is no issue of privacy, and that is all very well validated. So we have
Yes,
no concerns about the validity.
yes.
So do you think this is going to sort of replace? Are we going to get, have a sort of false sense of, going to get have an inertia in, ultrasound, or the skills
Oh,
going? So
it
that's
works the other
also a
way.
funny here.
Let me
That,
give you a few examples. Now, for instance, today in Arunachal Pradesh, we don't have enough radiologists. And if I were to give people who are very minimal training in radiology, or a person who's a senior resident in obstetrics and gynecology machine, and he or she is not skilled, AI then tells this person, how should I carry out this scan? Which is the ideal plane? And give them the actual expertise of a high-end expert. What else can our country ask for? That person is not dispensable. It's just that we're elevating that person's standards. And tomorrow, then, every radiologist and every younger gynecologist will want to learn this and say, okay, I'll try and improve my skills. And then once you have a little bit of moral support in the background, you say, oh, how wonderful. Now I have somebody helping me out.
yeah, guiding you
And
there.
AI is looking over my shoulder and saying, you're doing it correctly. And I've got the information I wanted, and this is working out very well.
Yeah, that's a
So
constant source of inspiration there. Yes, you're doing it right. You're doing it
you're
right.
doing it right, you're doing it right, and it worked out right. Or in genetics, I don't have to blindly say, oh, I found one finding. I know my finding, I put it together. Sometimes there are now uh, a lot of data going in on abnormal cases. So tomorrow the AI will tell us this is the abnormality, and you will just be reassured that, look, I was suspecting this, and it
Right.
is definitely that.
Connection. Right.
In that situation, we will have to wait, of course, for AI to evolve. But at least for identifying that something is normal, I'm sitting already there. For instance, I'm doing an evaluation of the fetal heart. And I'm relatively new to the fetal heart, and I haven't really got that much experience in radiology or in obstetrics to look at the fetal heart and do a detailed cardiac evaluation. I run a program in the background, which is called Diagonally and or Fetoli Heart. And it's a tablet which is connected to the cloud, which I connect to any vendor's machine. And it tells me, okay, you got this view and this view is likely to be correct. Or you've got this view and this view is likely abnormal. And then it says you missed out on this view, please do it and include it. And then while I'm watching this image on the screen, it tells me this is your right atrium, this is your left atrium, this is the pulmonary vein, this is the left and the right ventricle, the interventricular septum, and so on. Or
Learning as you're doing it as well.
yes, or this heart is not right in terms of its size. And already we are identifying, previously we were only looking at fetal heart rate with automation. Now we're going to be able to identify cardiac arrhythmias with automation. Now, you and me don't even know the gamut of fetal cardiac arrhythmias. And yet, some of them are so easy to treat. I need a diagnosis. We call a cardiologist. The cardiologist looks at the tracing and says, yes, of course, this is a supraventricular tachycardia. This is 37 and a half weeks, deliver. Or that this is supraventricular tachycardia. This is a 31 weeker. Let's try digoxin or fentanyl or stuff like that. So it really works out nicely. And sotalol is available everywhere. So you save lives without having to transfer the patient. And so this is what AI is doing for us today.
So you said that it helps the ones who are who are learning, who are not so skilled. But
Yes,
for legends like you, for experts like you who know
yes.
it all, how is AI helping you in that? Because we know
Okay.
that it is sort of for the ones who are beginners, who is guiding
Yes,
you. As I said, we learn as we do it.
yes.
But for you, for legends like Dr. Khurana sir, where you can see everything there, how is AI helping you, sir?
Okay, so I start work at 7:40 in the morning and I finish work at 9:40 at night. Am I going to be able to concentrate as much on every single patient? Am I going to get distracted? Is an anomaly going to upset me personally? Is there going to be a phone call from a relative that, oh, your mother-in-law is not well or something like that? I can't perform consistently throughout the day. This will make sure that I keep up my standards throughout the day
Oh.
because AI never sleeps and AI never gets tired. And it's working in the background to make sure that I don't goof up because the expectations from me as an individual are far more.
Okay, interesting.
Yes.
Yes.
And then the workload.
Yes.
I use AI, I use much fewer keystrokes. So if I have, for instance, for my measurements, an acquisition that I have in 3D at my BPD plane, it gives me 8 cranial measurements straight away without me having to do anything. So it makes my examination faster. I can see many more patients and I can concentrate my mind on putting that
Got
information together rather than obtaining that information. So I'll get my BPD, I will get my head circumference, I'll get my occipitofrontal distance, I will get the width of the atrium of the lateral ventricle, my cerebellum and my cisterna magna,
one shot.
all in one go without making an effort.
Wow. So,
Yes.
where do you think we'll be in the next, with all this AI increasing by the day? I mean, every day there's
Yes.
something new to learn. So, in the next 5, 10 years, where do you think this is going to take us, especially in the area of fetal medicine and
Yes.
genetics?
So in fetal medicine, it's going to make high-end technology less expensive because with AI working, you can do a lot more work on a medium and a low-end machine. B, we have so much of shortage of staff. It's going to be able to do a lot in that and make sure that I can do many more patients and it will work well. The third thing is that when I want to communicate across to an expert who is not available in my small town, then it's really going to be able to stratify care beautifully. And I'm going to get that opinion in my small town. My patient doesn't have to cross a flooded river or be carried in a charpai across and then brought bleeding in to tell me that, okay, the fetus is no more. And I could hear the heartbeat before she left the village. That is not going to happen. And I will know immediately that, yes, okay, there is trouble, but this is a central placenta previa. Don't touch her, we'll lose the mother. And then
Hmm.
I don't mind losing the fetus, but I don't want to lose the mother. So heartbreaking decisions like that will naturally change. The main thing is expense, and the more we use this, the better it will become. The other question is, will it make me redundant? Will I ever never be required? The other
Hmm.
thing is that AI is always taking the next step. And at each step, it is improving my performance rather than replacing me. So the person who does not use AI will become redundant. The person who uses AI will keep racing ahead and see many more patients and use their abilities for higher end things rather than basic things.
Okay.
So, if I have tomorrow 100,000 agenesis of the corpus callosum, which I feed into the machine, then my juniors can also do it. People newer in the field can do it. More importantly, I don't have to make an effort and it will say, okay, this is the agenesis of the corpus callosum. And in addition to this, there is this finding. Then I work so easily in my head and say, okay, I will do an amniocentesis at 17 weeks because I don't need a karyotype. I need DNA. My DNA is better at 17 weeks, and that sort of a thing. So I can change my whole diagnosis
So
completely.
as you said, which is the fear, isn't it? Like everybody said, AI is going to replace, especially the engineers. They don't have any jobs now. So even with medicine, I used to say, well, at least the deliveries AI will not do. It might replace anything else, but
That
I
is
don't
true.
think it will not. It will still remain as a supportive tool. Would you say that's right, or?
Always, always, invariably, because in medicine, there is subjectivity, which is the wisdom of experience. And we know that even in evidence that we have for what we do in any particular clinical scenario, you and me always have to have the overriding experience that will make us make a certain decision. And because we have these gray zones in decision making, we will have the guidelines in the background, but you and me can modify that and make sure that we have an optimal outcome. So in optimizing outcomes, the human being will never be indispensable.
And the learning curve for getting these, everybody, every time there's a new technology, everybody gets a bit intimidated of us, how do we incorporate this into our practice? You think the learning of the curve is going to be a steep one or not so bad as compared to learning ultrasound as well?
Learning becomes so much easier and the curve becomes steep. Tomorrow you're an expert. For the simple reason that A, there are instructions. So if I missed an instruction in a workshop, I will have to ask that question at the end of the workshop and I may not get a chance. If I learn it from a teaching video, I can run that video again and again 100 times and learn that, oh, that was the step that I'm missing out. So it is a much more patient teacher than anybody else and a much more efficient teacher than anybody else. And it's just like getting onto YouTube and deciding which is the best way to have the thinnest pizzas ever. And you miss one step and you're finished. You didn't pick up the right flour, you're finished. You didn't pick up the right soda bicarb, you're done. And this you can repeat again and again and say, oh, I got my recipe correct, I got the amount of cooking correct, and I know which microwave temperature I have to run it on, upper shelf, lower shelf. It's exactly the same thing. And so it makes your kitchen more efficient. You could, of course, just order a pizza from outside, but it's never the same. You want fresh pizza and
Absolutely.
you want the best pizza of your liking. And AI helps you to make the pizza of your liking.
And the satisfaction of doing it yourself in the right way. That
Of
is
Yes,
that is the most
and
important.
at a fast speed. I mean, I cannot hope to achieve this kind of wisdom of diagnosing, for instance, that there has been a deep transverse arrest, and I do it with the help of an attachment of software to my trans perineal ultrasound when I'm watching ultrasound in labor.
No.
And I know instantly that, look, this diameter is not going to fit. And my machine warns me, could you reassess this diameter in the progress in 20 minutes so that you don't go into a deep transverse arrest? I mean, how wonderful is that? Where do
Yeah.
I have that wisdom to say, okay, should I repeat my PV? Am I introducing infection? You don't have
And
to
how
worry.
correct is that? Because that is so
Yes, and
subjective.
then that is evidence tomorrow in court because now electronic evidence is acceptable in a court of law. So tomorrow it will prevent medical legal complications. So if my CCTG tells me that there were the correct amount of short-term variations and therefore this fetus is asphyxiated for non-obstetric reasons, I mean, not because of the mode of delivery or how I conducted my delivery, I will not have that lawsuit on me. I have evidence to say that yes, this was computerized, this was recorded, and therefore I am not responsible for the neurodevelopmental abnormality. That was a result of something else, maybe genetic, maybe an infection, and needs to be looked at, but I am not responsible. So it saves me from that.
So how do you think then we clinicians or the obstetricians and the primary physicians who are dealing should we how should we handle this? How do we incorporate this AI and how do we deal with this inflow of AI coming into our practice? What are
Yes.
your words
So
of
it's
advice there?
very simple. I use three sources. My first source is something called Google Scholar. And I put Google Scholar, the topic I'm interested in is intelligence in obstetric practice, artificial intelligence in fetal imaging,
Right.
artificial intelligence in fetal genetics. And whatever is published on these subjects, I keep putting the same names of the authors in there. And so 2 or 3 times a week at night, I will get the reference to these articles, and then I can source them. My second thing is that I make sure that I become a member of a society that does webinars on these things. And you know, the Society of Field Medicine in association with Foxy works really hard to disseminate information. And we work with Foxy all over the country, and we work with the radiology associations all over the country, and we work with the genetic societies all over the country, and we encourage people. And if people don't come to us, we go to them in our outreach programs.
Absolutely.
So
That's
that is that you become member of society. The third thing is that once it starts coming in on Google, then
really
Google
yeah.
is throwing this at you anyway. And you're looking at your email, you're looking at your smartphone, you're doing your online shopping, and it says, oops, bloop, and you get information. And then
Yes.
you have that information at your fingertips. The other thing is I run ChatGPT. And the basic form of ChatGPT, the unpaid form of ChatGPT. And I tell myself, ChatGPT, what's new in AI in this month? And first it starts, so well, private equity has invested $700 million here and $800 million there, and this is the expected outcome, and this is where the project is going. And then suddenly it says, there is also a new method of evaluating the risk of assessing whether the corpus callosum should be like this at 18 weeks of gestation. And then you say, oh, that's interesting. And I get onto that and I get the details and I say,
Let's try this now.
I know now that my MRI, for instance, is not to wait until 26 weeks. Today, I am able to produce on my standard 1.5 or 3 Tesla MRI the beginning of the corpus callosum at 13 to 16 weeks of gestation.
Wow.
And they're doing it in Austria. So then I say, very nice. Now I put Gregor Kasprian on my Google Scholar, and every time he prints anything or he's cited or he's a part of the authorship of an article, it comes up on my Google Scholar and I read it. So there is no way you can get left behind because your smartphone is your best friend today.
Absolutely. And that has changed our world a lot. So I'm sure.
Completely. Yes. Today, I need to take a picture of an abortus. I don't have to sit with a studio camera. I use my smartphone and I send that across to my genetics friend. And she tells me immediately, so what were the ultrasound findings? What is the family history? What's the pedigree? Tuck, tuck, tuck. She gives me an answer. She says, okay, send me 1 centimeter by 1 centimeter skin from the abortus, and I will carry out, even without an autopsy, I will be able to carry out genetics for you. And 6 weeks down the line, I have my answer.
That's amazing, sir.
Yes.
And I must thank you for all that, the Society of Fetal Medicine has done for, as you said, incorporating all this in our webinars and the outreach programs. So that's really helping a lot of
You've been a part of it. You facilitated this yourself.
absolutely. You've given
Yes.
us the opportunity to do that, sir. So thank you for that. And I must, appreciate all that you've done. But as you said, especially for low-income countries, it is helping the bridging the gaps in fetal medicine.
Yes.
So I think, that will definitely shape the future of fetal medicine, isn't it, sir?
Yes, absolutely so. And
Uh,
it will bring fetal medicine to the patient's doorstep.
Right. And as I asked you earlier as well, how are the patients' receptiveness or response to these using these? Are they more, they're more that they're aware of it, or they're more excited about it, or some people say, no, it's all technology based. I don't want it. So, what has been the response? Because we personally, at least I personally, have not used it so much
Yes.
as you would have. So, can you share your experiences in that, sir?
Yes. And it's amazing that they may not believe what a physician tells them, what a family physician tells them, what an obstetrician tells them. They will believe what a phone tells them. So if they have something on a smartphone screen, it's God's own word.
Yeah,
And so they're much more receptive to this information that comes through computerization than information that comes through non-computerization.
absolutely.
It's our dependence on Google and WhatsApp. So
Yeah.
to be able to transfer and reuse WhatsApp instead of its misuse like it's going on. Everybody's appointed themselves professor of the University of WhatsApp.
Yeah.
We are able to convince them that, look, you can use this for this, and you can check this for this, and then you can move on to ChatGPT and not get confused with old articles on Google. So that is the huge difference it has made. It has much more validity in the minds of the people when something is on their smartphone. So it's easier to convince them.
And so, what do you see what is most exciting for you in this area of AI that is coming up? I mean, um, looking at what is happening, what could be the next step that we could have in AI in fetal medicine? What do you
Yes.
think?
So the next step is that without having a qualified person, in each single hamlet and village of this country, we're going to be able to promote medical care remotely. So we don't need that much skill. We don't need trained individuals. We need people who will supervise the less trained individuals or the non-physicians in these places. And that information comes to me, and then I'm able to put it together. So in the dispensation of healthcare, we will need a much smaller budget. And that is really the answer for low and middle income countries. That thank God for us now, at least we have roads going to every single part of our country, and every village is connected by road. Every village is also has internet, and almost everybody has running electricity at all times. Thanks to that, this technology will make sure that nobody, even in a village of 25 people, will be neglected or have to go very far. Because one wise person over there can sit in their chopal, so to say, and do an ultrasound scan blindly. These are going to be handheld units, they already exist. And all you have to do is you don't even need an ultrasound scanner. You connect your smartphone to this unit electronically, you do a scan, and you get your answer. Pregnant, not pregnant. Heartbeat present, not present. You've done a sweep, I don't see something inside the uterus, urgent referral for ectopic pregnancy. It's already here. The future is here already. All we have to do is to refine it.
Absolutely. It's no longer a buzzword, isn't it? It's a tool.
No, not at all. It is
It's
it is what I call aloo tomato pyaz. It's
yes,
part of what we
because
manage
it
to eat every
actually
day.
changed the shape of fetal medicine, made it more accessible,
Yes,
more accurate, and more personalized, isn't it, for every individual?
definitely. And nobody gets neglected.
Yes.
Nobody dies for want of care. Why should a woman die of pregnancy today? By treating, for instance, we did this wonderful program in Odisha during COVID where we taught people, we managed to get ultrasound scans in every primary health center, which was upgraded to a first referral unit by having an ultrasound scanner there and a blood bank. And we worked with UNICEF and two wonderful people in Odisha, Dr. Shama Kannungo and Dr. Hasmukh Lal. And we did 50 classes online. Then we trained the trainers offline. And then we went there and worked on this. And immediately Odisha jumped up from 25 on the list of maternal mortality to 15. And it was so wonderful. So mothers are not dying there anymore. And with the addition of AI on that program, we can have the most inexperienced obstetrician still producing the best results. Whereas no skilled obstetrician and no skilled radiologist will want to even go and live in that village.
Yes.
So it's going to save us this problem of being attracted by money to go to a village. No, I will have the quality of life I want in my town. That information is coming to me automatically, facilitated by AI. And therefore, whoever wants to be in the village stays in the village, who wants to be in the town stays in the town. But my patient gets the care she deserves, and my fetus gets the care the fetus deserves.
So having heard all this, it's too good to be true, isn't it? I mean, it's something that, so are there any fears at all that anything can go wrong? Sometimes when this technology takes a boom. So
Yes.
just being honest, I'm being the
So
devil's advocate here.
one of my fears is biological warfare. Because every time you do genetic tests, the Indian genome gets passed on to anybody. And you can create biological warfare of the kind that we saw in COVID, for instance. Luckily, that went wrong. And so the world got saved. Otherwise, the aim was to really make money out of the vaccines and then get a planet to call your own.
Hmm.
Now, this kind of biological warfare is always potential, but it can be done even without AI. So then
Yeah.
why bother to do anything? So if the risks are equal with AI or without AI, then why should I hang AI at the cost of having
No,
a very,
absolutely.
very doable option?
Yeah, the advantage is far, far, far more than, whatever else might be.
Truly so, truly so. And that is the perspective we always have
It's
to
just
see
that, I was thinking a lot, it is something that every time you
Yes,
hear an AI will do this, AI will do that. So somewhere we say, is it all okay? Are we in the right place and the right direction? But
yes,
yes, I think it is, it can be done even without AI if somebody thinks of doing it. So that's a
true.
different,
Yes. So the criminal mind will always work as a criminal mind, and everybody else will do their good work.
yes, absolutely.
Yes,
So,
yes,
as we're nearing the end, what would your advice be to the upcoming, people, the radiologists or fetal people who want to do fetal medicine? Because
yes,
every time something new comes, they jump up. Like, 3D came, they forgot the 2D, they jumped into 3D, doing
yes,
very well. We have to go step by step. So, in
true.
that way, sir, what would you be your words of advice or, to
Yes. You
the
see,
beginners?
the first thing I would like to tell them is that, look, today, technology is an integral part of your life. You cannot do without technology, washing machines, air conditioners, artificial
Yes.
intelligence. It comes in the same breath. The second thing is to keep an open mind. If you keep an open mind, you're going to make sure that you enhance your thinking and your style. You can always withdraw from it if you get too much, and you can go into the world of yoga and go and sit on the beach in Goa. But the thing is, how much of your life can you spend? A person like me would not be able to spend more than, say, 7 weeks in Goa. Here, I can do half my day doing artificial intelligence and getting all my reports to Goa, and the remaining 7 hours I can sit on the beach. So professionally, it can be very, very satisfying. But you have to have that open mind, and you have to have that sense of realizing that learning something new is not difficult. It's like an app on your telephone. I know that if I were to plan a holiday, I could go to Google, but I could go to an airline app or I could go to a travel agency app and also plan a holiday very well. And I learned that automatically on my smartphone. Why not learn it for my patients? So translate it into what we use in everyday life, and it works very well. So the open-mindedness is the first thing we require. And remember that there is always somewhere on the internet something to facilitate you in every single problem that you have in life.
Absolutely. That's why it's called open AI, I guess. You have to have an
You're
open mind.
absolutely correct. Yes,
Yeah.
completely. Yes.
So, I mean, it's been amazing, sir, talking to you, and so enlightening that we have so much in store and so much of exciting things in store for us to explore and learn. And as you said, we all have to keep an open mind. But thank you for sharing your thoughts on this, on how AI can change the face of fetal medicine, not especially in terms of technology, but improving the care of the women you said they deserve. So, some parting words from you, sir, before we end this beautiful podcast.
Thank you, first of all, for having me here, for giving me the chance to speak so openly at over such an extended period of time. And remember that the secret of life is to always challenge yourself to move ahead. We can't sit on our laurels, we can't sit on our backsides. We have to keep on creating challenges and pressures for ourselves so that our mind doesn't go into degeneration.
So true, sir. And then you are the best person to say that because we're seeing you from so many years, and your zest to learn, despite sort of having been there, is amazing. And I think that is the biggest source of inspiration we all have, because when we see our teacher trying to learn and new things, that itself drives us, the biggest learning force for us. So thank you
Thank
once
you.
again, sir, for being here tonight and sharing your thoughts on AI and fetal medicine. Thank you so much, sir.
Pleasure indeed. Thanks very much.
Thank you, sir.
Bye bye.
Bye-bye. Good night.